Good afternoon. I'd like to welcome everyone to the next series of webinars. This one is Managing Domain Names in the Health Industry. And with that, I'd like to introduce myself. My name is Daniel Greenberg. I'm a non-practicing UK solicitor and non-practicing South African attorney that heads up the Brand Protection Department at LexSynergy. And we basically deal with trademark owners and brand holders that want to protect their rights in various industries online via domain name registrations or through the recovery of domain names. So in this particular webinar, we will discuss domain names in the health industry. Like any other industry, the internet has had an impact on the health sector. And with that, there are a number of risks, such as buying counterfeit drugs, obtaining incorrect health advice, purchasing drugs without prescriptions. So today, we won't deal with that type of complex issue, but rather address the name or domain names that are being used in the health industry and the options that are available to those that want to legitimately promote, market, and sell healthcare products. So before we get into that, I just want to reiterate we are a global domain name registrar and brand protection specialists. As you can see over there, we operate in a few countries, the UK, US, Tanzania, Australia, South Africa, and Kenya. We offer our clients 24/7, 365 support. And just to put things into perspective, and where LexSynergy fits into the scheme of things, this is a who is who. So as you can see from this particular flow chart, the registrant being the domain name owner, the brand owner, you as the attendee would own your own domain name. To register that domain name, you would have to go through an accredited registrar such as LexSynergy. You would go through us, register the domain name, and it will be then registered with the registry or the domain name authority. In most instances, a domain name registrant cannot register directly with the registry, but has to go through an accredited registrar. There are a lot of resellers out there or third parties. These are parties that interact with an accredited registrar, either via an API or an EPP connection, in which they use this accredited registrar to register domain names. So the reseller can have different branding, it can promote other products, but essentially they are not directly accredited. So what we generally advise is go through directly through an accredited registrar so that there are less parties involved in the chain of registering a domain name. There are some other providers that fit into the picture. For instance, internet service providers, those are providers who give you access to the internet, and then a web host provider who gives you web space so you can upload your website. Some of the health-related TLDs that we'll discuss today is .health, obviously, .pharmacy, .hospital, .med, .insurance, and .md. So starting off with .health. .health is recently launched. It's currently in the qualified, in the industry access phase. And what that phase means, it's restricted to qualified health industry brands, organizations, and people that are involved in the health sector. So until or just before the GA starts on the 5th of December, if you fall within that sector, you can register a .health domain name. We've seen quite a large uptake of .health domain names just because of the relevance of the search term and industry on the internet. It is advisable if you are in the industry to secure it before the 5th of December, because then it will be open to the general public without restriction, meaning that all the good domain names will most probably be taken by the time you want to secure yours. So it's good to act early. The next TLD is .pharmacy. .pharmacy is a restricted TLD in that in order to register a .pharmacy domain name, I've just picked up a typo in the sheet, but .pharmacy, and that's funny enough, one of the issues with .pharmacy is that it is a bit difficult to spell for non-native speakers, as well as it's quite a long domain name. So if you have a long name, .pharmacy can be quite long. But essentially what it is it's restricted to pharmacies or those that are involved in the pharmaceutical industry. And as you can see on that page, there are a number of other types of registrants that would qualify for a .pharmacy domain name. The registrant, before you register a domain name, must complete an online application and receive a token to register a .pharmacy domain name. So once you've done that with the registry operator of .pharmacy, you would use a token, log into Lexinergy, and register your .pharmacy domain name. .insurance, although this TLD is not specifically allocated to health insurance, a lot of health insurance companies are registering .insurance domain names. .insurance is also a restricted domain name, which means that only insurance companies regulated by a government authority or licensed insurance agents, agencies or brokers or brokerages regulated by a government authority can register a .insurance domain name. This TLD also has a verification process, which means when you apply for the domain name, an independent third party will contact the registrant to verify their information and that they are in fact an insurance company. The reasoning behind that is, and the same with .pharmacy, is that when members of the public see a .insurance or a .pharmacy domain name, they will know that there are higher levels of security in how these TLDs are, these domain names are allocated to registrants. So there should be greater care in that regard, and it also creates a more trustworthy point of contact within those industries. Too often today, as you'll see in some later slides, it's so easy to infringe upon a well-known trademark or a particular business. So with this in mind, these types of restricted TLDs are quite crucial for these industries to prevent or to minimize the risk of fraud and other fraudulent activities. There are a number of other healthcare-related domain name extensions out there, TLDs, such as .care, .clinic, .dental, .dentist, hospital, and so it goes on. These are donuts TLDs, so that's the registry operator. There are no restrictions, so it's open to all, first come, first serve. They are normally cheaper than the restricted TLDs, such as .insurance and .pharmacy. And because it's open to all and is cheaper, it is open to squatting. So if you operate within the health industry, you should at least acquire the domain names within the TLDs that are applicable specifically to your industry. Another quite interesting TLD is .md, the country code top-level domain name for the country of Moldova. And the abbreviation is MD for medical doctor. So it has been repurposed by doctors to secure domain names matching their particular names, such as drsmith.md or smith.md. It's quite a unique way of rebranding a TLD. There are a few new gTLDs that still have to launch that relate to the healthcare industries, that is .meds, .medical, .cancer research. So we would suggest keeping an eye out for those. We have a domain name extension table list where we list new gTLDs that are about to launch. So if you visit our website, you'll see new extensions, and then under there, there'll be a drop-down which says launch timetable. If you go to that particular page, you would see all new gTLDs that are about to launch. We also thought it's relevant to show how the healthcare industry is not immune to cyber squatting, and in fact is a prime target. An example over here is the Johns Hopkins Hospital. Someone's registered Johns Hopkins Hospital. As you can see from the markup there, it's registered by a Jared Reichbaum at a Gmail address, and he has set up an affiliate links. These affiliate links, when you click on it, the registrant would earn on a pay-per-click basis, could then divert potential people that would engage this particular hospital or university. It would redirect them to some other types of resources and may divert them away from interacting with that organization. So something like this should be addressed. We assume that there is a trademark for that name and that the trademark owner should try and recover that, because it could cause confusion. It could have some other issues, especially in the health industry, where sometimes people may release confidential information like medical records or medical history to a person that controls a domain name that is cyber squatted on. Another example is Kaiser Permanente. If you can see the misspelling over here, it is not so apparent at first glance, but when you look a little bit closer, you'll see the I and the A and I have been swapped around in Kaiser. So over there, the person who's registered the misspelling has used a privacy service to conceal their true identity, and has also set up affiliate links relating to the healthcare industry. So something like this, an unsuspecting customer may not spot this and be redirected to another website or a competitor. The original one is kaiserpermanente.org, spelled K-A-I and not I-A. We'd also like to talk about very briefly a matter that in which we assisted a insurance company in South Africa that provides health insurance to recover the domain name sanlam.mobi. It was registered by a cyber squatter. A complaint was filed under the UDRP, the Uniform Domain Name Dispute Resolution Policy, and in that we were successful in recovering the domain name because we could prove the three elements of a UDRP. And those are that the client has a trademark that is identical or confusingly similar to the domain name, and they have rights in that particular trademark, and that the cyber squatter had no legitimate rights or interests in the domain name, and that it was registered and used in bad faith. So if you have been affected by some form of cyber squatting or type of squatting, we can assist you in the recovery of that domain name under the UDRP if it is a generic top-level domain. If it's a country code, we would have to advise you on the procedures, as every country code has its own unique procedures for recovering domain names. Another important aspect to address within the health industry, because there's so many domain names out there, a trademark owner may have them scattered among several different providers. So what we propose to our clients is centralize them into one account. So as a corporate domain name registrar, we're bringing domain names from the various registrars that the client has registered the domain names with into our portal. It is a live system, so the information that they see is correct and updated on the WHOIS. It also centralizes the administration. It becomes more cost effective. It also helps to enforce rights, because if you see a domain name or you identify a domain name that's infringing, you can then assess your rights much better, because you can look at your whole complete portfolio without having to log into several accounts and to determine whether an employee or a third-party provider registered that domain name. It also provides consistent WHOIS information. That's the information that you use when registering a domain name. So as you can see here, here's an example. If you had to centralize your health domain names, on the left-hand side, you can see domain names that are registered across multiple registrars. All the registrars are listed there, such as PSI USA, and Each of them is probably in a different control panel, payment under different currency, different support mechanisms. When it's centralized, as you can see on the right, all your domain names will be consistent and updated. The next page also shows that. On the left-hand side, you can see an uncentralized domain name. That is where a domain name is owned by an employee. They're using an email address of their employer. It is a domain name that their employer may not know about. That person could leave their employ, and then the domain name could be deleted. It could provide crucial services to the company, and with the result that it could be deleted due to non-renewal or hacked by someone accessing the account unlawfully and transferring the domain name away, which, funny enough, is a common occurrence. On the right-hand side is what a centralized domain name looks like. Generic information, the client's information, a generic email, an email address that the client can receive communications at, and this type of information is applied across the portfolio so that there is consistency. Here is another example of what it would look like, just the type of information. Once, as you can see on the left-hand side, it's all a bit scattered with different bits and pieces of information from different entities and parties. On the right-hand side would be the domain names, who the registrar is, the contact, that would be generic, so it's not a specific person, so you don't have to keep updating the who is information as people are being replaced within the organization, and then a standard email address that can be forwarded to relevant personnel within the organization. And as mentioned, the cost of centralization is cost efficient because you know what you are paying for your entire portfolio and the renewals and registrations, as opposed to keep on having to keep track by Excel spreadsheets and quotes from various different providers. Also, as a corporate domain name registrar, we are one of the most cost-effective, making sure that you can then save money on your renewals and registrations, so you have more available in your budget to pursue infringements and to have a more proactive brand protection strategy. What we do is, if you have a number of domain names, and after listening to this .health webinar, you realize that you'd like to bring your domain names under one roof, this process describes how we work. We'd set up an account for you. We'd have an introductory call discussing how we work, how the centralization process works. We then start the centralization by using the domain name list that you provide. We then confirm the domain names to make sure that they are in fact registered and that you do control them. We then prepare and obtain a letter from you authorizing us to start the centralization. We then coordinate the transfers for you, so we take care of the entire process. In some instances, we may need your input for more complicated TLDs where there's paperwork, but we handle that for you. Once that's complete, all your domain names will be in your portal, and then we would conduct a global domain name audit, which is kind of a health check of your domain names to see whether there are gaps, infringements, or any other issues affecting your domain name that could expose your domain names that could expose you to risk. We then discuss the results and we develop an enforcement monitoring and registration strategy for you. And in that, we identify what you own, what the infringements are, domain names owned by third parties, ex-employees, and the like. Then also the domain name policy is drafted that sets out how you manage your domain names internally. So it's a document that you would then use to convey how you deal with domain names through your organization. And after that, we have a follow-up call and then biannual domain name audits, which are free, just so that we keep your domain name portfolio up to date, making sure that we're closing gaps or identifying risk areas from time to time. So there's some features, Lexnergy features that you can see over here. You'll get a dedicated account manager, 24/7, 365 technical, email, and telephone support. Competitive pricing. We offer over 1,000 domain name extensions, so there's no need to use several providers. We have flexible billing options, currency options. We also provide training courses, which is quite important for marketing and legal, so that they're brought on to, so they're on the same page when it comes to domain name management and what's required to manage a cost-effective and efficient domain name portfolio. We also have a local presence service where if local presences are required, for instance, there's a local restriction, we'd help you overcome that through our local presence. And we give you a summary of the various domain name extensions as their various rules for the different TLDs, and there's free email and web forwarding. There are various other features that you can access. It's free to register an account with us. Once your domain name portfolio is centralized, you can export all the information via Excel or CSV. You can perform all functions such as transfer, registration, updates, DNS changes via the portal, or you can contact your account manager who can do that for you. We do back orders, and especially in the health industry, if you realize that someone has registered a domain name and the domain name is about to be deleted, we will put on our back order service so that when it is deleted, our system automatically attempts to re-register it. If we're successful, then that domain name is yours and you don't have to go through the recovery process as you have already acquired the domain name. So we do that. So that service is available as well as SSL certificates. And you can create sub-user accounts, so you can, especially in the health industry, you've got various agents. You can give them limited access or restricted access to certain domain names for them to perform certain restricted actions. And we also have two-factor authentication, which is an additional layer of security. And what that does is it tries to reduce the risk of someone hacking into your account. So you'd use Google Authenticator to access your account. So if someone does know your username and password, they won't be able to log into your account without that two-factor information. So that was a quick run through of domain names and TLDs and issues facing the health sector. If you have any questions or would like us to look at your portfolio and provide recommendations, feel free to get in touch with us. Our details are listed there, and then we'll be in touch with you to discuss the best strategy and way forward. Once again, I'd like to thank you for attending, and we look forward to seeing you in our next webinar. Thank you.